Hello, and welcome to this lecture, the Chrysalis Diploma in Counselling Skills and Theory. Component 5, Relationships, Bereavement and Loss. And this is Module 7, focusing on bereavement and loss. You can find the standards met by this particular component outlined in Moodle and in your written course materials. I'll be sharing some slides with you throughout this lecture, and you'll be able to view and download these slides from Moodle as well if you wish. Please note any questions you might have as you're watching this lecture and take these to class to discuss with your class tutor. Hi there. So today we'll be focusing on death and bereavement. However, all losses can have a big impact on us, and even positive changes like a house move can also have an impact. Everybody reacts differently, and we'll be looking at this more shortly. But let's first of all look at the range of losses that we might experience during life. Starting from when we're a baby, we could lose our dummy or a security blanket. That might be one of the first things that's taken away from us. And this can actually be quite traumatic for a baby. And of course, we could experience the loss of a parent in many different ways. And as we get older, these losses can increase. So we could move home, we'll make friends, but as we move schools, we'll lose some of those friends. We'll lose teachers. We might move neighbourhoods and lose a lot of the people that we know. We could lose our health. We could lose a sibling, a parent or a grandparent, a pet. We might even move countries. We might have to adjust to step siblings. And we could lose our self-esteem from neglectful parenting or from being bullied at school. And in adolescence, moving from that stage of being a child to becoming an adult, we can lose our sense of dependence on other people. We might question our religion and decide to give that up. We may move into intimate relationships and then lose them. And also we may lose our self-esteem, again, through bullying or through not achieving what we thought we could. We could lose that sense of success. And we can again experience things like burglary or natural disasters, which can really happen at any age. And as an adult, we could lose our job, our finances, our partner, our home. We could lose a baby. A parent can lose their child. And also identity. And as we move through to older age, our children leave home. And again, we might question, who am I now? So again, it's a sense of loss. And as we get older, we might lose friends. With the loss of our job might come that loss of sense of purpose in life. We may not be able to do some of the things that we used to do. And so we'll lose that sense of fulfillment and achievement. And as we become even older, we've got the risk of losing our hair, our teeth, and our mind, and our bodily functions. Doesn't sound great, does it? So all of these losses can can affect us in different ways. Everybody is a unique individual, so we'll be affected differently. And a lot of the time, it depends on the emotional attachment that we have to these things or to these people. And positive losses can also generate that loss reaction. Like to be in control of our lives as human beings, and we have no control over these processes of loss at all. And death has always been a bit of a taboo subject in our society. It's often something people find difficult to discuss, and people don't know what to say to someone who's just lost their partner or their child. And if we're experiencing a loss and then experience another loss quite soon after, this is going to become more difficult for us to deal with, and it could lead to pathological grief, which we'll look at later on. Now, a lot of people would say that they're not afraid of death, but only of dying. So obviously death is one of the main big losses that we could experience in life. The death of somebody really close to us is obviously very traumatic, and it often makes us question and think about our own death. So let's look at some of the top fears around death and dying. And this is what many people have said, that it's the thought of leaving behind our loved ones and the things we have in this life. It's that total loss of control, of not knowing what is really going to happen. It's leaving unfinished business, or not having done what you really wanted to do in life. Rather than the death itself, it's the pain and the suffering, or violence, traumatic death, that really people worry about. Also losing dignity, the mental bodily functions, or becoming a burden, and sometimes worrying that that's how we'll be remembered rather than when we were at our best. Fear of the unknown, and fear of how people will manage without you, especially if you have dependents. Some people, depending on their beliefs, might fear being judged or disappearing into annihilation. And for some, it's the fear of failing. So lots of fears around death. And yet health professionals will tell you that people do not die in a state of panic normally. Often people seem to rally round within 3 days of death. And it seems that at that point, they've come to acceptance and they're not afraid, and sometimes elated. So they're quite relaxed about it. Often those with some solid religious or spiritual beliefs will be outwardly less anxious about the process, because they believe they know where they're going, where their destination is, and what's going to happen when they get there. But sometimes our beliefs can also be challenged when someone is taken from us, especially if they're young or die in a traumatic way. We often have those thoughts about why, how is this fair? So let's look at some of the theories around grief. Let's look at Colin Murray Parkes. Now, we go through certain stages, and all these theories that we're going to look at are similar. we experience these stages because of the attachment that we have to someone. We grieve differently for the various people in our life, depending on that emotional attachment that we have to them. And there's been lots of work done on attachment. And in your module notes, there's work about Harry Harlow and the famous study of the wire monkey, which demonstrated the preference of a baby primate for affection and nurture over the physical need for food. And Freud suggested that an infant's emotional tie to its mother is the foundation for later relationships. And John Bowlby looked at the adverse effects of early separation and the effects of hospitalisation, the infant away from the mother. And he was interested in studying the actual patterns involved in both healthy and pathological development. And he went on to develop and identify the 3 phases of separation, which are protest. So the baby cries and protests. And then the second stage is despair. And so if the mother doesn't return, then the child goes into this phase of despair. And then stage 3 is detachment, where the baby actually doesn't care anymore, they're detached. And when the parent does return, they may ignore them. So it's believed that grief results from our biological need for security in the face of danger, and that the goal of attachment behaviour is to maintain that security, provided by a significant interpersonal relationship. And so hopefully, as a baby, if we get the care and attention that we need, then we develop a secure attachment. But if our needs aren't met, then we may suffer neglect or inconsistency or abuse, and we might have an anxious or ambivalent attachment, and that carries forward in life with us. So bereavement reactions are responsible for both a physical and mental illness. And it's been showed that people that are widowed are 10 times more likely to die within the year following the death of their partner. So we may get people as therapists, clients will come to us when they've experienced a recent loss, or it can be that a client presents with other symptoms or presents with a different issue, actually is due to a bereavement or a grief reaction that hasn't properly been worked through. So understanding these different theories of loss can really help us help our clients. So if we look at Colin Murray Parks, stages generally follow a similar theme to Bowlby's. So the first stage is numbness or denial. The person refuses to see the death as real, and this is really a coping mechanism to let it all sink in. It's too much to sink in at once. So we feel numb, we're in denial, and gradually we're able to process it. The second stage is pining. And this is a time of intense longing and unconscious searching. And then disorganisation, where the person realises that the loved one is not coming back. And this can be accompanied by anguish, all the what ifs, and despair. But we move through that process to reorganisation, where the person can start to build a life without the deceased. Although anniversaries, birthdays, Christmases may trigger that grief reaction again. So it's a process. William Walden's tasks of grief, similarities. So the first stage is to accept the reality of the loss. And this involves accepting and realizing that the person isn't coming back. We're not going to be reunited with them. So it's really coming out of that stage of denial to that realization that the person is gone. And then to work through the pain of that grief. We have to go through it to come out the other side. And not everyone experiences the same intensity of pain, but avoidance is detrimental in the long term. If we just repress our feelings, if we try to avoid them, they'll still be there bubbling underneath the surface. So although it can be really painful, it's best to try and work through these feelings that we get. And then it's to adjust to an environment in which the deceased is missing. So trying to move forward in life without that person. And obviously, how difficult that is depends on the relationship with that person and the space they filled in your life. And to emotionally relocate the deceased and move on with life. So it's not about forgetting the person, but they take a different emotional space in your life and enable you to continue with the process of living. Elizabeth Kubler-Ross talks about stages of dying, and she actually worked with terminally ill patients and noticed that they also go through the same process as those who have been bereaved. So at first, the processes are denial. No, it can't be happening. And as I said, that's a defense mechanism that prevents us being overwhelmed by the initial shock. And then there might be anger. It's not fair. Why me? And that could be directed at medical staff, God, or any other person. And this is the same when you lose a loved one. There can often be anger. Sometimes that anger can be towards yourself as well. And there's bargaining. And again, here you're thinking of all the ifs and buts and attempting to almost postpone the death. And then comes the lowest phase, which for some people can be a full-blown depression. And this can happen when the realization really sets in that there's no alternative and the death is inevitable. And then that is followed eventually by acceptance. And this is the same when a loved one dies. We can go through a really low stage with lots of different emotions and behaviours, but most people move out of that phase gradually in their own time and come to some acceptance and are able to move on with their life. So these three different models all have a lot of similarities, and from them we can really get to this grief curve. And this represents a normal grief process. And it's really useful to show our volunteers, our clients, therapists, because it helps them to feel that what they're going through is normal and valid. Now, the time it takes people to work through this curve, again, varies depending on the person's attachment, the person's previous experience, the environment they're living in, situation in which the person died, and other factors. And it's not a straightforward process that we just start at the top, work our way down, and then come up the other side. People can move forwards and backwards on the curve. And the time that it can take is really about 2 years for some people, although it can be much quicker, again, depending on the situation and the attachment. And again, it can be longer. So there's no right and wrong. But let's just look at this in a bit more detail. So the first stage is that shock and denial, when we don't want to admit to ourselves that it's happened, when that denial defense mechanism kicks in. And we might try and avoid all talk about the subject. We might feel confused. We may feel numb. And gradually we'll come out of that denial phase, and that's when we might get really angry. We might feel frustrated. We might feel also anxiety, embarrassment, shame. We may blame others or ourselves. We may feel really sad and cry a lot. There may be them searching behaviours, all the what ifs. And so we'll experience a lot of pain in that stage. And we may have dreams. This is when there may be that pining for the person. And then we'll get to that lowest point where we'll maybe feel a bit depressed, or sometimes very depressed. And some people at that point may need some help from their GP and possible medication, because they'll feel totally overwhelmed, and they may feel hopeless and helpless, and it can affect their energy levels. They'll feel tired but maybe not able to sleep. They'll feel in despair, may not be able to concentrate and function at work or on household tasks. And sometimes people question if they can go on, and even whether they want to go on at this stage. Most people come through this phase and over time start to feel slightly better and may reach out more to others and have more desire to talk about their loved one. But they will still be struggling and may still have those feelings of anger or guilt or confusion. So they may be up and down an awful lot. They can experience lots of different emotions. And they might start to go out with friends, but then feel really guilty that they've done that and they've had fun. They might find themselves laughing and then feel guilty for laughing. But then comes the real acceptance. And that's when people really fully accept the reality. And although they can experience lots of different emotions still and are triggered by birthdays and anniversaries, they are able to begin to move forwards in their life. And then they return to a meaningful life, feeling happier, feeling empowered, feeling that sense of security and good self-esteem. So a new pattern emerges where the deceased doesn't play such a huge part in the person's life. And memories will be able to be brought forward and discussed without causing too much distress. And it's important that a volunteer that you're working with, or a client when you're a qualified therapist, understands this process and realizes that whatever they're feeling, it's okay and it's all perfectly normal. Let's just look more at some of those things that people can feel. So anxiety, fear, as I said, it can bring up fears around death. The anger, guilt, all the if only I'd done this, if only I'd done that. And usually that guilt is unfounded. Shock, sadness, loneliness, pining, yearning. Also, sometimes relief and a sense of freedom. If the person has been suffering, there can often be that feeling of relief. And then there's all the thoughts of disbelief, confusion, preoccupation with the death. And sometimes feeling that sense of presence and hallucinations. And this is where we have to really take the person's beliefs into account and not assume when they discuss hallucinations that there's something wrong with them. And there can be various behaviours. It can affect sleep, can affect appetite. We can be confused, absent-minded. We may withdraw from everybody and not want to see anyone. We may avoid doing things. We might call out in our sleep and have nightmares. We might find ourselves sighing a lot. We might feel restless, like we don't know what to do. We might cry a lot. And we may treasure objects. It might be difficult to let any of the deceased person's objects go. And there'll be physical symptoms, which can be tightness in the chest, that feeling of butterflies in the stomach, the nausea, heightened sensitivity to noise, a sense of depersonalization can affect our breathing. We might feel weak and extra tired, lacking energy, lacking strength. We might not feel like getting up in the morning. Our motivation can go. We might experience dry mouth and aches and pains in our body. And again, the difficulty sleeping. And obviously, some of these, and especially mixed with the anxiety, can lower our immune system. So we're more likely to pick up viruses as well. And then that makes us feel low. And so it's a big combination of feelings, thoughts, behaviors, and physical symptoms. And people need time to adjust to this. So each person going through a loss can deal with it differently, and it can affect our relationships with others. You know, if one person is dealing very differently with a bereavement to how their partner is dealing with it, that can cause conflict. Some people might throw themselves back into work where others need to take a lot of time off from work. Somebody might want to stay in bed and withdraw, where another might want to seek out her friends and have company all the time. And these are all normal reactions. But we also need to look at pathological grief and the factors that may affect the grief process. So let's look at these. So the nature of the attachment. Obviously, if you're very close to somebody, it's going to be very difficult to deal with the loss. Couple that have been married 60 years, when one of them dies, clearly is going to be very difficult. However, somebody who's had a secure attachment in early life is more likely to deal with their grief better than someone who's got an anxious or insecure attachment. And an ambivalent attachment can be very difficult. So, for example, where somebody was maybe abused by their father, they may have feelings of love and hate. Love because it's the father, but also hate because of his behaviour. And when there's that ambivalence, it can make it very hard to grieve. The mode of death, so the way in which a person died, and their age obviously has an effect. We expect older people to die, whereas we don't expect younger people to. If somebody's had a traumatic accident or been in a fire, then that's going to be more difficult to deal with. A horrific car accident, a violent death, a murder, uncertain deaths, suicide, or where someone goes missing, they're all very difficult to deal with. Historical antecedents. So, previous loss experiences that were not really dealt with and resolved will have an impact. And also, people with a history of mental health problems may have a more difficult time. So it's important that we look at someone's previous experiences and also their mental stability. Personality comes into it as well. People diagnosed with a personality disorder may have a challenged ability to deal and assimilate the events. We also know that some people are just generally more positive than negative, and maybe it's easier for them to grieve. There's social variables, so our culture and our beliefs can be a comfort, but again, they can also bring up feelings and questions, and we might start challenging our beliefs or religion. And then concurrent stresses. So if people are going through a lot of other stresses when they experience a loss, it's going to make it more difficult to deal with. So if somebody is just going through a house move or a relationship breakup or a job change and they have financial problems as well, it's clearly going to be more difficult to cope with it all. And some people may fail to grieve at all. And that might be for a variety of reasons. Maybe the person has experienced a really difficult relationship with the deceased. They may have a complex mental health issue. It might be that the person's missing, so they've got no closure. It could be that they just have to bury all their own feelings because they want to be strong for other people. So when we talk about pathological grief, that can also be described as complex, complicated, abnormal, or unresolved grief. And it's really somebody who has not worked through the grief process fully. And pathological grief can be described as a response to loss that's either excessive in its duration, it's going on a long time, or in its severity, intensity. And we must also remember that grief may not be always shown in an outward way, but our body will often show symptoms. So somebody might have somatic symptoms or bodily symptoms, but not recognize that it's due to a grief process. So we can categorize pathological grief into these 4 different reactions. So we've got a chronic grief reaction, and this is where the person is aware that what they're feeling is due to grief, but the reaction is excessive and it doesn't reach the resolution stage. People can get stuck at different places on the grief curve, often in the depression stage. We've got a delayed grief reaction. This is where a person will have a reaction, but it's not of the sufficient proportions to enable them to work through the whole process. So somebody might maybe try and be strong for their family members and won't really grieve sufficiently, but then there could be another loss, maybe just the loss of a pet some months later, and they then go into an excessive reaction. There's the exaggerated grief reaction, where there's a lot of intensity and the person may resort to maladaptive behaviours. And we may see here depression, phobias, panic disorders. There might be self-harm, eating disorders, or addiction. And then there's the masked grief reaction, where the person doesn't realise the connection between their symptoms and grief or loss. You know, if people don't express their grief, their feelings, they will manifest in another way. As I said, we can't just push our feelings down. We can't repress things because there will still be an effect. It's all bubbling under the surface. And it will either come out in a physical manifestation or maladaptive behaviours or even a mental breakdown. So it's important to be aware of the symptoms and behaviours of pathological grief. And there's quite a lot here. So depression is often related to a loss that somebody hasn't worked through properly for one reason or another. Previous history of difficulty when facing loss is a sign. Reports of a minor event triggering severe grief reactions. Somebody who can't speak about the deceased without an intense emotional reaction. Reports of excessive guilt or self-reproach. If there's panic attacks, physical expressions of fear, somatic symptoms relating to the deceased. Themes of loss when you speak to a volunteer, if you do a timeline and there's lots of losses in the person's life, that can indicate that they could be suffering with pathological grief, or could be prone to pathological grief. Symbolic or actual searching behaviour. Physical distress, feeling something is stuck inside them. An unwillingness to sort out the deceased's belongings. Hypochondrias, and distorted thinking around the death as well. Not always getting the timing of things accurate. Making radical changes of big decisions. And recurrent symptoms on anniversaries or birthdays or Christmas, even years down the line. Depression over a long period of time. Excessive euphoria after death is also a concern. Compulsively imitating the deceased in a way that the client otherwise wouldn't have done. And self-destructive behaviours like addiction, self-harming, not eating properly. Diminished participation in previous religious events. And phobia around illness or death. So these are all signs. They don't all necessarily mean that a person is experiencing or likely to experience pathological grief, but they're things to look out for because they could indicate it. And obviously you would need to find out more to be able to assess that. And so people going through a pathological reaction will need more intervention. And so grief counselling would come under helping someone through a normal grief process. Whereas when we refer to grief therapy, it's somebody who is maybe going through a pathological reaction and needs more intervention. And it can take a much longer period to work through pathological grief. And it might also take a while to find what the root cause of the problem is. And so for a therapist, working with unresolved grief can be challenging, but it's also very rewarding. But at this stage of your training, you're not able to work with complex grief and would need to refer the client on. If you want to work in this field, when you go into year 3 or at the beginning of this year, when you start looking for a placement, you could try places like Cruse, bereavement care, or a hospice, because this would obviously give you experience more in working with bereavement and loss. So let's move on to how we would help somebody with a normal grief process. So it's about bringing the loss into reality, allowing them to identify and express their feelings. It's unlikely that somebody would come for grief counselling when they're still in the shock or denial phase, because they haven't accepted that it's actually happened. If somebody did try and talk about it too early, it'd probably be the wrong time. It would be better for them to process it a little bit in their own mind and then have some therapy. So we're trying to talk to them about what happened, their attachment, letting them express everything they want to, because people often don't want to burden their other family members or friends with their feelings. So being able to just talk to a therapist is really, really useful. We can show them the grief curve and assess where they are on it, explain it, and then we can assure them of the normality of their reaction. We can talk to them about how likely it's how long it's likely to last for before they start coming to a bit more normality. It's also about helping someone find some meaning in the loss. And for some people who can be really depressed, it's about looking at what they can do to move forward, what they've got to live for, what the other person would be wanting them to do with their life. So we need to try and find some meaning. And we need to help them move on through the stages on the grief curve in their own time and not rush them. As things progress, we can assist them to live without the deceased by looking at decision making and coping skills. Maybe somebody has never had to cut the grass or put up shelves. And it's looking at the things they think they can do and things they think they can't do, and finding resources within themselves, as well as being able to ask for help. And so we're helping them to emotionally relocate the deceased within their life. They're emotionally placing that person somewhere else and filling up so that they have got space for other things in their life. And we need to give them time to reach resolution, remembering that each person is unique and may take a different length of time depending on the attachment, their personality, the support they've got around them. And it's very important while we're doing that we're looking out for signs for pathological grief reaction, and that we refer that on as soon as we recognise it. A client may never have really expressed these things before coming to therapy, and so providing that safe space with a non-judgmental, empathic listener can be so beneficial. Letting them just offload and tell their story and express their feelings is probably the most important part of the therapy. And obviously, to do this, we're using the core conditions and really a lot of person-centered skills. Of course, we also need to look at psychodynamics, because the past is very relevant to all of this. Their previous experience of grief, their previous coping skills is all important. Their previous attachment issues from early life, all of those things will have a bearing on how they grieve. So we need to be working psychodynamically as well, but when the client is ready. And CBT can also be useful to look at feelings of guilt that are not really justified, feelings of blame, any negative feelings that the client has. We can use CBT to help. So the grief curve can be supported by our pluralistic approach. We also need to bear in mind that funerals and other rituals can be very important for people. And again, this is going to vary depending on their culture and beliefs. Often some deaths are not viewed as important in society. Miscarriages, for example, I think it's better than it used to be years ago, but often people are expected to just move on very quickly. But it's still a loss and very, very important to people. And often people don't have a, a burial, a grave, a place to go. And sometimes people like to set up their own little shrine at home, or just an area in the garden where they can go and talk to that person if they wish to. Writing letters to a deceased person can be very therapeutic. Well, um, and many people like to do that, or keep a journal of their feelings. So there's various tools that we can use within that pluralistic approach that is going to be very helpful to our client volunteer. So today we've looked at the different losses that we can experience in life. We've looked at fears around death and dying, the different theories on grief and loss and how they're all tied up with attachment. And we've looked at the symptoms, the many symptoms of grief. And finally, we've looked at the difference between normal grief and pathological grief, and how we can help someone with normal grief and the need to refer on those with a pathological reaction. So to finish, let's just go over those ethical issues. So it's really, really important to only work within your own competency levels and refer where necessary. Volunteers can often have physical symptoms that may be present. And while we might believe that they're due to the grief reaction, we don't know for sure. There could be something physically wrong with them. And so for that reason, we need to refer any physical symptoms to the GP. We need to work within an established framework. So using these theories that we've learned about today, using the grief curve and using appropriate models of therapy within that pluralistic approach. There is information in the module notes about children and grief, and this is just for information. If you want to work with children and if you want to work with pathological grief, you will require further training. And it's really important to remember that each client is unique and will grieve in their own way. There's no absolute right or wrong. It's also important to make sure you've worked through your own losses. Because if you haven't worked through your own, how can you help somebody else to do that? And if you do have a bereavement or lots of stress going on in your own life, then you may not be equipped at that time to help volunteers. And it's important to not bring your own beliefs into a session, but be respectful of the clients. Remember that we're being non-judgmental, and a lot of our volunteers will have different beliefs to us. And we need to respect that and be open to listening to what they have to say. But we can't bring our beliefs into the session. It's not about us. And we're not trying to push our beliefs onto them. So it's having respect for their beliefs, their culture. So that is the end of the presentation for today. As I said, if you've got any questions from this or from your module notes, please take these to class for further discussion with your tutor. Thank you for listening, and bye for now.